Fox News parent company told employees this week that proof of vaccination is no longer required in order to enter office spaces, according to an internal memo obtained by the Daily Beast. The company had infamously imposed the measures in the summer of 2021.
Last week, we learned that the NBA won't have a COVID vaccine mandate either. This comes after the saga last season with Brooklyn Nets star Kyrie Irving, who was only allowed to play road games after initially refusing the vaccine.
So people, with the Fox News thing, I think people were pointing this out in the insistence that this was some kind of hypocrisy, given that many hosts on Fox were opposed to these mandates. I never really got why that was considered hypocritical, because it's not.
It's a mandate.
Right. The hosts are not in charge of the building, and
right.
So you can have the View. Like I could have the View. Like we didn't have that policy here, but we could have had that policy here. It could have been imposed on us, despite my own belief that having a mandate was wrong. So it's not. I didn't quite see the hypocrisy aspect of it.
Right. The argument could be you actually opposed mandates because you were subjected to one and you were very unhappy about it.
Right.
So that's entirely consistent.
Right.
But I do think it was more about the idea that the people who run Fox, the big baddies, the Roger Ailes of the world, et cetera, who are presumed and often proven to have similar beliefs to the beliefs that are often discussed about on the programming, for them to back such a policy was inconsistent. Less so the host, but that
maybe it was imposed on them too didn't New York City had some kind of, you had to show your vaccine card for a while. When last I was there, which was a little bit of a while ago, you had to go into a restaurant or something. Mm-hmm. You had to show your vaccine card. I think the last time I was in New York, it was the case that when you were there, you had to show a vaccine card, but then you didn't have to wear a mask when you entered the door till you sat down, which I preferred to DC, where at the time you didn't have to show a vaccine card, but you did have to wear a mask for the walk, which I find so ridiculous. But then DC also implemented a vaccine mandate, so it was just the worst of all worlds. But anyway, regardless of what cities and companies and businesses were doing before, the reality is now we all know that being vaccinated is not a public health measure. It's good for your health, especially if you're at an at-risk category, if you're an elderly American, and so on and so forth. But that's your decision. It's not doing very much to contribute to tamping down the spread of the disease in general. So many people who are vaccinated have gotten COVID, some multiple times. It's not. If it makes you less sick, maybe then less symptomatic or something like that, so you're less likely to spread it. But it's not. By and large, it's not we need to vaccinate other people so that I'm okay in the workplace, so I'm less likely to catch it. That's just not the case. Yeah,
they definitely oversold that point, and the reason was because that was the biggest inducement that they had to convince people to go ahead and get vaccinated. Even if you don't want to do it for yourself, do it for your community more broadly. The question that I have is, well, that's the question I have is, it was very early on in the pandemic. Obviously, the vaccines were brand new. They didn't have time to get data when you come up with a rushed vaccine and push it through the process quickly in order to address a global pandemic. So was it a good faith belief that it would stop the spread more than it ultimately did, or was it really just a coercive tactic to encourage people to go ahead and get the vaccine? I'm not sure that we'll ever really know that.
It did hold up better against the initial strain, at least for the first few months. The protection was pretty robust.
Yeah.
Then Delta hit. We started having breakthrough cases. I remember when I got my breakthrough case last July, right as Delta was starting, and being like, oh, I'm one of those very few, those lucky very few who are going to get breakthrough cases. And then by the next month, I was like, oh, there's a lot of breakthrough cases. Then Omicron hit, and it's like, well, everyone, doesn't matter, does not matter, you're going to get it.
Yeah, so I do think that I don't think it's necessarily fair to charge whether it's the NBA or Fox or any of these institutions who promulgated these policies with bad faith, or to say that they were necessarily bad actors, because we were all, one, it was more effective early on, and two, we were all kind of just trying to make that up as we went along.
They're bad actors. It's the government health advisors, and perhaps the pharmaceutical companies themselves.
I much prefer a world where we err toward caution, obviously outside of the world of mandates and people feeling literally coerced or losing their jobs and things. But I personally would have been happy to go ahead and say, if they had been transparent, assuming they knew, and said, we're not sure exactly how much this prevents transmission, but there's a possibility it would be helpful, I would be happy to personally to take a hit. But I do think that now we're in this world where, because there's been so much revision on a lot of these policies that were really articulated as certain and firm, you're going to get people questioning advice going forward, which is not good from a public health perspective.
And people were given a sort of implicit and in some cases explicit promise that if you did get this vaccine, even if you don't, maybe you're younger and you're not particularly at risk, but if you do get it, we're easing up restrictions, so you should do it as part of that effort to no longer have to have the lockdowns and school closures and masks everywhere. And then they went right back to recommending those things, in some cases explicitly forcing them on people, even not at risk populations like school children, which was part of the kind of just broken faith approach the government had.
Well, luckily there are no lockdowns and the mask mandates are gone. So there's very little in the way to complain about. We got to where we needed to be. And the question now I think a lot of people are thinking about is the next virus.
They're not entirely gone though.
Land.
I believe there are some school children who will be returning to school this fall, and they'll still have masks. College campuses, some of them will still.
Well, yeah, of course, private, a lot of private institutions, they have their, good old libertarian right to do what they want to do and enforce what they want to enforce. As I said in a recent radar, I would much prefer there be more of an emphasis on HVAC systems and getting ventilation in a lot of these places, especially since they've been shown to reduce the spread of COVID by about 41% as compared to some of the, bad mask, use of masks that aren't very effective, the basically flimsy paper ones that don't do much of anything at all, and the fact that young children aren't especially compliant. If people really do have those kind of public health interests, I would like them to be doing those kind of investments, but those require more substantive investments than people individually going and making masks, and we've seen a lack of commitment to making it easier for people to comply if it costs money from the government, and much more offshoring of responsibility on individuals, and now we're seeing the backlash to that.
Well, just last week, 50 GOP congressmen sent a letter to Secretary of Defense Lloyd Austin in an attempt for the DoD to reconsider its vaccine mandate, citing the impact it will have on the National Guard. If it's enforced, up to 60,000 National Guardsmen and women, 11% of the reserves, they could be let go. Congressman Mike Waltz is leading that effort. Here he is discussing it on Fox News.
And in this case, you have a vaccine that has now been shown not to stop the spread, that it's a personal health decision on what kind of symptoms you want to endure versus guaranteed to lose tens of thousands of soldiers you can't replace. And the Guard is on the front line of everything from hurricanes to going over to Ukraine and overseas deployments. We just can't afford it as a nation to take this kind of a blow.
And I agree with what he's saying there. I think with the National Guard, it's an issue, the vaccine mandate, this is an issue of practicality rather than an issue of principle, because principle, our service people are forced to, they have to give up certain liberties to be employees of the government to work for us and work to defend us. So in principle, I am not as opposed to this sort of thing. But practically speaking, I don't see any reason to force a National Guardsman who doesn't want to get the vaccine to get it, assuming that if they really don't want it, it's not protecting other National Guards. Again, the public health part of it is not really a rationale. It's for their own health. The
only way I would distinguish one could distinguish a National Guard case from the broader public is that if they do get sick and have a longer course of COVID and have a more disastrous run of things and have to be hospitalized, et cetera, that does, one, take them out for longer and, could conceivably yield the same kind of dip in the workforce that we're talking about if all 11% of people actually resigned, especially given these waves we've had that are very infectious, the close quarters people have to be in these situations and all those kinds of things. And moreover, I'm not, I don't know entirely how their health insurance is funded, but it does seem to me that there is a certain degree of investment in not having, the state pay the cost of people who are getting sicker than they might ordinarily get. Now, I'm not saying that should necessarily determine how you think about this one way or the other, but as a lawyer, that's how I would distinguish the two cases if you were trying to make the case.
But these have to be people, hopefully, I hope the people in the National Guard are physically fit and young and otherwise healthy, and thus extremely unlikely to have a very negative COVID health outcome, in which case I would not override their personal desire not to get vaccinated.
I do think that sometimes the way that we talk about who is at risk and who isn't, it ignores a lot of invisible disabilities and vulnerabilities people have. A lot of people suffer from asthma. That puts you on the list. A lot of people, even if you don't look especially unfit, have diabetes or pre-diabetes. People have type 1 diabetes. A lot of people have any number of autoimmune disorders that put them at particular risk. And it is a little, heart conditions, mitral valve prolapse, a lot of things that wouldn't take you out of the running for being in the National Guard, but very much put you at risk. And when you look at the actual percentages of Americans who do fall into the high risk category, it's basically most people. And I'm not saying it's most people in the National Guard.
But certainly not most people who are at risk of having a very negative COVID health outcome.
I don't know. I really caution people with that, because I still remember the early days of COVID where a lot of people who were young and healthy, and people were very surprised. There were some tragic stories of a lot of journalists and people who were very much on Twitter, really shocked to find that their loved ones succumbed. And as much as I think it's really valid to critique the CDC overreaches and kind of misinformation that have been promulgated over the past 2 years, I also don't want folks to lose sight of exactly how scary those early days were and how unpredictable the virus is. It's not just the flu.
All right, well, Team Rising will join us next, so stick around for that.